I welcome Nandini to the Afro Asia MHM Summit 2021. I'm delighted to have you, Nandini, and learn a lot about your journey, what you do, about Femcy. We want to know it all. Thank you so much for joining us today, and I look forward to this interview with you. Nandini Gopal is the co founder and CEO of Femcy, an app based mobile platform that offers personalized nutrition and lifestyle expert guidance for better menstruation and menstrual health. Femcy offers personalized, comprehensive lifestyle management guidance for menstruators based on their symptoms and menstrual phase, as well as on demand teleconsultation with menstrual health experts. Femcy app helps improve the monthly menstrual issues that 70 to 80% of women experience, such as PMS, cramps, bloating, and it can aid in boosting fertility for women planning pregnancy. Even more, Femcy can help with flagging concerns, symptoms sooner, and facilitate early diagnosis and menstrual conditions such as PCOD, PCOS, endometriosis that may lead to infertility or delayed pregnancy and other issues. Femcy is available for download on Google Play Store in India, Singapore, Philippines, and the UK, and is coming on iOS as well. I am delighted and really excited to learn about the entire journey. I have a few questions for you, so let us just get straight to it. How can AI help in the betterment of health in women?
Menstrual hormones, the so called female hormones, have an effect on every system in the female body, from digestion to metabolism to sleep to mood to gut and bone health. Hormones play a role in all of these. Did you know? We didn't know that migraines were related to the menstrual hormone cycle until the 70s. Yet, conventionally, menstruating women are left out of many clinical trials. Because of this, very little data is available on how menstrual hormones impact and are impacted by medical treatments. For better women's health, we need to collect this data at scale. AI and mobile based technologies can help in collecting and analyzing female health data safely, securely, and conveniently. This body of data can, in turn, fuel more research and better health outcomes for menstrual, sexual, and reproductive health for women.
There are a lot of menstrual health tracking applications. How do these apps function and validate data?
You're right, there are certainly a lot of these apps. They come in a range of qualities and functionalities, but mostly in the color pink, sadly. They offer everything from simple calendar style tracking apps to the ability to share menstrual health data with our loved ones to being a great source of personalized information about our health. They offer supportive peer communities, and some of them are even smart AI based early diagnostic apps. Most of them, however, are based on simple algorithms and rule engines. But there are also some newer apps which are starting to take advantage of AI and predictive analytics. But how safe and secure are these apps? I'd say more than 90% of these apps in the menstrual health tracking space are not HIPAA compliant. That means they don't treat the health data that we input securely. Even worse, they may be monetizing our personal health information. They may be selling them to advertising or marketing targeters like Facebook or Google. That's not right. And that's why it's important for us to do our research in choosing the right app for both our health and privacy needs.
How are you planning to use AI or technology to eradicate menstrual hygiene issues among women?
In many parts of the developing world, menstruation comes with a lot of taboos. This often results in poor knowledge of menstrual hygiene and, even more, a lack of awareness of atypical menstrual symptoms. Pain, for example, has been socially normalized as part of the female experience, when in many cases it can actually be an indicator of chronic menstrual conditions. Leaving these symptoms undiagnosed for a long time can result in infertility that is, in some cases, irreversible. And again, that brings a lot of social stigma to the women in these, developing parts of the world. We are working on improving the chances of early detection of menstrual conditions by encouraging users to track their symptoms safely and helping them access guidance on supporting the nutritional needs of their body. Nutritional needs, again, have a significant impact on menstrual health and managing these chronic conditions. We also help them get alerted about their atypical symptoms sooner. For these features to be effective, however, we need large quantities of data, which means we need a lot of users on the app, and that's what we're working on right now.
What all challenges do you face when you are linking the two terms, menstruation and AI or technology?
So many. Okay, from taboos, our users are hesitant to download an app for menstrual health on their phone. They're hesitant to pay attention to their symptoms and bodily discharges. They are hesitant to track those using an app instead of just keeping it in their heads. There are also privacy concerns, say, like who's seeing the questions that I ask on a forum, who's answering, how safe is this app, should I really enter my health data into the internet? And there are also trust issues. I mean, is this app giving me the right guidance? What are the qualifications of the people who are behind this app? Can AI or automation ever be a substitute for a doctor? Many of these are really valid concerns, right? AI in healthcare itself is a very nascent field. Combine it with emerging research on menstrual health, and it's still in its very early days. So I actually applaud users for approaching all of this with skepticism. That is a lot better than trusting spurious information that's available everywhere on the internet. Our job is to make a safe, trustworthy, convenient, and private solution for our users' menstrual health needs. And we know that when we've done it right, our users will let us know because they are eager for the right solution.
How can we create a sustainable ecosystem using AI and technology?
For the menstrual health ecosystem to be sustainable, we need to close the loop. And for that, research needs to represent menstruators, take their health concerns seriously, and build targeted therapies. Not just that, we need to then take those therapies and get them to access larger and more unreachable populations. Only then can we, move toward adapting our existing health technologies and therapies to meeting localized needs, and that in turn will help us to make better therapies that will meet those specific needs. That's when the ecosystem becomes sustainable. And AI and technology, they are already central players in making that happen.
Why is it important to promote the adoption of AI and technology in menstrual health?
AI and technology can help to stretch these resources to reach people who lack access to quality medical care. It can help promote awareness, flag atypical symptoms, support medical care with lifestyle guidance, enable teleconsultation, capture more accurate patient history, personalized recommendations for wellness products and other aids, and so much more. Without AI and technology, the onus for doing all of this, providing all of these services, would be on the medical professionals. And we can see from history that when the medical system isn't able to shoulder this load, women's health outcomes are the first to suffer. And that's why it's important to promote the adoption of AI and technology in menstrual health.
It has been a wonderful conversation with you, Nandini. I look forward to further collaborations with you, and it has been a delightful afternoon to learn about Femcy, what it does, how it brings AI and integration into health, specifically to MHM. I am sure it is going to be a boon for us menstruators to use apps like yours so that it can make our lives easier. Thank you so much.